Okay, this is Dr. Sara Siddiqui. I'm here for this month's Elwood Public Library presentation, and we're going to be talking about pubertal growth and development. And let me just start sharing my screen. Okay, so I thought that this was, since this is October, we should do a Halloween themed presentation, and this is regarding pubertal growth and development and how to talk to your kids regarding that. So I do get this question a lot during our checkups, and I'm just going to give you some like little tips and pointers. We're not going to go into details regarding the growth and development, but I gave you some things that you can use to kind of as a sounding board to talk to your kids. So how to talk to your child about changes happening in their body during growth and development, and it's a Halloween theme, so I thought this was so cute. Okay. All right, excellent. Okay, so disclosures. I have no disclosures to identify, and please talk with your primary medical provider for any specific questions, and send in questions to Elwood Public Library if you have any questions or concerns or anything that you want to talk about, any future themes or things that you wanted to have me speak about. I would be happy to do. Okay. And so puberty is a time of rapid growth and multiple physical changes. And this is just a website that I got some of the information from. Of course, the American Academy of Pediatrics is always a good source of information. There's a website called healthychildren.org that has a lot of information on it for you, and it can go into detail regarding growth and development as well. Next slide. So growth and development in children varies a lot. So every child is a little bit different. They're going to follow either their parents or genetic factors. And there's a lot of age ranges that kind of can determine when the beginning of puberty or changes that can start it. So definitely age 8 or 9 is an age range that we tend to let parents know to start kind of looking for those changes, and they can vary from emotional changes to actual body changes, which we will go through a little bit. But it is really important to kind of talk about or maintain that line of communication as early as possible. You want to just make sure that you're talking to your child as much as you can. You want to communicate with them. You want to make sure that they tell you if there's any changes that they're concerned about or anything in their body that they're not sure about, any symptoms or anything that they want to talk to you about. You want to really leave that line of communication open. You want to be open-minded. You want to encourage them to speak with you. You want to limit what you kind of feel about what they're telling you until after they finish telling you what they want to say. Make sure you hear them. Make sure you talk with them and not to them. So in females, it can start puberty, or some changes can start as early as age 7 or 8, and boys may start a little bit later, age 9 or 10. And again, puberty is a normal, healthy part of development. And how do we start the conversation? So this is a tough. Sometimes as parents, it's always tough to kind of start it, but believe it or not, the kids may be ready sooner than you think. So it's important to start early and over multiple times. It's not something that you just talk about once and leave it alone. It's something that you continue to talk over a period of time. You kind of bring it up and take their lead, and if they want to talk about it, that's fine. If they don't, that's fine too. Take into account your child's comfort level. If they're really not comfortable talking to you about it at that time or that place, then that's okay. But at least you open the door for them to discuss it with you at a future time if they feel comfortable. Usually there's something that a friend said, or something that happened in the classroom, or something that happened at some point, and they want to talk about it with you, and that's usually how the conversation starts. And again, you want to really leave the opportunity open for them to speak at some point. And all bodies develop at different times and different ways. So what I tell my patients a lot, or the parents a lot in the exam room, is that there's a lot of genetics involved, and there's also a lot of when their child is ready. So this is really important. That's why I left a whole slide for it. So use accurate language. So you really want to name the parts of the body accurately. You want to make sure that you have language that you use with your child that is really accurate, so that they're aware that each part of their body has a specific name associated with it, and that they should be comfortable using it because there's nothing embarrassing about their own body. There's something, their body is something to be proud of, and that body confidence is really important. Their self-esteem is starting to build now, and you really want to impart that to them. So you want to use accurate language when you're describing certain areas of the body. So the first signs in pubertal development, usually girls develop a little bit earlier than boys. They start going through some changes earlier, and usually girls start changing at around age 10 with certain parts of their body starting to develop. And you do want to keep in touch with your pediatrician. Again, any issue or any concerns, specific concerns that you have, you'd want to talk to your pediatrician. I always say that prior to any of my talks. This should not be used as medical advice for specifically your child. You want to take any specific concerns to the person that knows your child the best. So you and then your pediatrician. But call your pediatrician if you think that your child's body is advancing faster than normal. If a girl or female is kind of developing before the age of 8, you notice some changes in their body, secondary to puberty changes, then you do want to check with your pediatrician, because there are certain things that we do to make sure they're not entering puberty too early. And for boys, it's usually age 11 that their body starts to change. And again, you want to call your pediatrician for boys if things start changing earlier than 9. For girls, sometimes menstruation can start 1 to 2 or even 3 years after their body first starts to change. So usually if you use age 10 as like a standard for your first start to body changing, usually 12 to 13 is when your menstrual period is going to start for most girls. But again, that's dependent on their genetics and, perhaps mom or even aunts, and that can decide too. And at the bottom there, I have a little bit of a source that you can go to. That's the healthychildren.org that I mention a lot. That has a lot of information that even pediatricians use. So tips on discussing puberty with your kids. So use actual body part language for the private area or genital area. For girls, the genital area around the vaginal area is called the vulva, and for boys, the penis and the testicles. Keep things short when talking to younger children. Their attention span is going to be a little bit shorter, but you want to make sure that you use this time to encourage communication. So you don't want to shut it down. You want to make sure that if they want to talk about it, that you talk about it. Use day-to-day situations to trigger conversations. Kids will ask questions, so really listen to your children. Make sure that you communicate and answer their questions if you have trouble or if you're not sure. Kind of fake it till you make it, and then ask someone, or I'm going to give you some books to kind of reference also if you need help. And these are really great areas to kind of go through with your child. Don't wait to have the talk. It's really never too early, and it's not something that you need to kind of say, okay, we're going to have the talk today. It's kind of something that you do over a period of time and consistent, kind of continuous messaging. And kids are getting exposed to these topics in school, on TV, online, on Snap, and all those other social media devices a lot earlier than what we were used to when we were growing up. So the kids are aware of a lot of information prior. So you do want to use, and you want to make sure that you start the conversation early. And again, puberty is a normal part of growing up. What I tell the kids when I see them in the office is it's part of changing from your girl body to a woman body, or a boy body to a man body. And remember, remind your kids that there's nothing wrong with the changes that their bodies are going through. This is all a normal part of the process. And again, try not to look uncomfortable or embarrassed. So your kids don't feel uncomfortable or embarrassed either. This is a normal part of growing up. It's something that they will learn about, and they will learn about it with you. And it's something that you want them to ask you about rather than their friends or them looking it up online. So you want them to come to you for the most accurate information. So for parents to know, for girls, usually a little bit of their body odor can change as early as 7 or 8. And sometimes I'll tell parents that if they want, they can start recommending some deodorant at that time if they would like. This is a good time to discuss personal hygiene, washing themselves, cutting their hair or cutting their nails, making sure that they're groomed, they're just taking care of themselves properly. Again, breast buds is something that can develop, and then hair growth under the arms and in the private area. They're going to go through a growth spurt, and then at the end of all that, for girls, usually there's the menstruation that happens at the end, and this takes 2 to 3 years from the beginning. So once there's some changes in their body, that's the time that you want to take to try to discuss with them and prepare about their body changing. There's a lot of emotional changes that occur at this time because of hormonal ups and downs. Their mood can kind of change and go up and down, and sometimes they don't even realize why their mood is changing. They may feel sad or happy very quickly and not even realize why that's happening. So it's really important that you give them that kind of reassurance to say that this is normal and this is something that you went through and it's something that everyone goes through. This is also a time where their peers are influencing them a lot, and they can kind of feel uncomfortable at the certain changes that they're going through, that they feel that they're alone. But it's really important that you reassure them that everyone goes through these changes at some point in time. Also, for especially for females that are going to start menstruating, it's really important to go through dietary habits. So proper sleep, proper nutrition, proper exercise is really going to help. Is really going to help them get through, and maintaining a good diet in healthy protein is going to help when they do get their periods on a monthly basis. For boys, pubertal changes occur a little later than girls. So middle school is a common time for boys to feel a little bit uneasy because girls are kind of rapidly growing. They may get taller than them in the middle school time, but it's a very short period of time that happens, but it can happen. And boys usually tend to grow a little bit later. And the first thing to kind of happen in boys is their testicular growth and scrotal growth happens at this time. Their shoulders start to broaden, their body grows taller. They also start to have increase in body hair, and this happens over a period of time their voice starts to change. And this can happen a year or so later after things start changing. And then again, the sweat and oil of their body starts to change in composition. And this can lead to acne or facial changes. And the acne is really a part of the hormonal changes that are going on. This can cause clogged pores and facial acne, and it can cause some type of where they get a little bit of self-confidence issues. So it's really important to talk to them about this, to talk to them that this is a normal thing to have body positivity, and to help them through if they are having difficulties with acne or with things on their face or their body. Then it's really important to talk to your pediatrician or perhaps go see a dermatologist. There are many, many things that we can do to help them and to get through this phase of puberty, and to help ease their sometimes what can be a quite difficult time in how they feel and how they look. As far as emotional lability, boys also go through a time of emotion. Usually people don't realize that boys also go through mood changes, mood swings, especially when they're going through pubertal growth. They can get angry, upset, sad, and it's okay for boys to be emotional as well. So you really want to make sure that you speak to them or have that line of communication open. That's probably one of the most important things for your children through emotional growth, through their pubertal growth, to have that emotional support that they get from their parents. Because right now their peer relationships are growing too, and a lot of peer influence is high. So what their friends think about them or what they think that their friends are feeling about them is really important to them right now. So as a parent, it's really important to be supportive and be there and be listening to them right now. And encourage questions from your children regarding their body that's changing. Make sure to let them know that they are the boss of their body, that no one else is allowed to say anything about their body. They are the person that's supposed to look at their own body and be advocates for their own body. If they have any questions, they should come to you, but you should kind of encourage them to ask you or ask their pediatrician, or make sure they come to you for any concerns or questions. And no judgment about how they're feeling, and their body positivity is really important right now. Their self-confidence is kind of it's at a particular point where what you say or what their friends say really matters to them. So be really cognizant of what you say and how you say it to them. There's lots and lots of information online in book form and on websites. So I gave you a few things here. I love the American Girl book talking about you. I love the book called The Care and Keeping of You. So I gave you some resources here. And there's lots of information that you can get. And you can even talk to the Elwood Public Library, and they would probably give you a lot of resources as well that you can go through with your child. There are some books that are kind of early for the younger set, and then there's books that are even later that kind of discuss more detailed issues. Again, talk to your pediatrician. Every WellChild examination is an opportunity to talk about growth and development in your child. Hopefully your pediatrician is going through the growth chart with you and going through how they're, what they're doing. They're usually we kind of check and make sure they're developing appropriately. Make a list of questions to ask at each checkup regarding puberty and development. Ask to see the growth chart at the visit. Ask how your child is growing, and ask about the emotional well-being of your child, because now's the time where things can change. And of course, make an appointment sooner than the WellChild checkup if you're concerned, if you're thinking that your child may not be growing enough or maybe growing too fast. These are both concerns that should be brought up to your doctor. So I hope this kind of gave you an idea or a stepping stone or an introduction to how to kind of begin the conversation. There's really no like age or anything to start. You can just start as soon as you can, and just really make it an ongoing discussion and make it an ongoing conversation. And now's the time in these ages like 8 to 11 or 8 to 12 where you're building a foundation with your child, and the stronger that foundation is now, the adolescent period is a little bit easier. So 12 to 15 or 12 to 16 is a little bit easier because you have that foundation that you already established, built on trust and built on repeated conversations and communication, and just really making sure that your child knows that they can come to you for any issue and that you will help them to solve it or help them find the answer that they want. So thank you. I hope you guys loved the Halloween theme. I know I did. I know I really enjoy doing these talks, and I hope that you get out of it what I even a little bit, and I'm happy to do them. Again, thank you to the Elwood Public Library for allowing me to do these talks every month. And please keep in touch with your pediatrician regarding any issues that you may have regarding growth and development in your child. Thank you.